This story is about a wounded human stranded in an alien medbay, where doctors argue endlessly over how to treat him. Fed up and bleeding, he grabs a knife and a manual, then does the unthinkable. Tyler Reese woke up choking on a tube. It wasn't the worst way he'd regained consciousness. There'd been that one incident involving a crash couch, a busted oxygen filter, and a jar of pickled eggs, but this was definitely top 3. He yanked the tube from his throat with a wet gag, his arm trembling like an overcooked noodle. The lights overhead buzzed and shifted color, casting pale violet hues across smooth, white, oddly curved walls. Nothing human designed. He tried sitting up. That was a mistake. Pain flared from his right side like someone had rammed a steel rod through his ribs and twisted. He slumped back, breathing hard. Definitely at least one fractured rib, possibly more. His left thigh throbbed with a deep, pulsing ache. It felt wrong, thick, tight, too hot under the skin. Something was swelling. That wasn't good. A chittering voice buzzed nearby. Then another, deeper and slower, chiming in with nasal vowels and vibrating tones. Tyler blinked toward the sound and saw 3 aliens arguing in a corner of the medbay. One had a wide, flat face and orange skin mottled with green patches, blinking 2 sets of eyes out of sync. The second was taller, with translucent skin and a floating motion, as if it half swam through the air. The third, he wasn't sure if it was looking at him or the wall. It had no visible eyes. None of them seemed to notice that their patient was awake. He did a quick self-assessment. Sharp pain in the ribs, heavy bruising across the left side, thigh swelling, possibly due to internal bleeding or a hematoma, dry mouth, dizziness, and his right hand had a crusted gash that was starting to ooze again. And there was something else. He wasn't sure, but he suspected a partial pneumothorax. His breathing had a hollow flutter to it. "Hey," Tyler rasped. "Nothing?" He swallowed, then louder. "Hey, over here, guys!" The orange one startled, whirled around, and let out a musical honk. The other 2 followed suit, now speaking over one another in rapid tones. A glowing blue panel appeared mid-air, and the translucent one jabbed at it with a spindly limb. Moments later, the alien voices were replaced with a mechanical translation. A voice buzzed through the ceiling speakers, speaking fluent but flat English. "Patient is awake. This contradicts projected neural repair timeline." "I was projected what now?" Tyler groaned, trying again to sit up. The alien with translucent skin floated over and hovered uncomfortably close. A scanner whirred over his chest. "Human recovery parameters remain inconsistent. The lung defect has self-limited. Probable tissue cohesion via unknown factor. Data conflict." "I'm sitting right here," Tyler said. "You could ask." The third alien, eyeless and silent, clicked at a corner terminal with a long digit. A screen blinked red. Then another argument started, low tones and clipped syllables. Tyler didn't need a translator to understand the vibe. He'd seen the same kind of argument in a dozen ERs. 3 physicians, 1 patient, 0 agreement. Only this time, they weren't even sure what species they were dealing with. "I think my leg's swelling," Tyler muttered. "Can one of you—" The orange one turned to him, speaking through the translator. "Human tissue regeneration lacks standard metrics. Our current understanding is based on outdated Terran autopsy files and a holographic sitcom labeled Scrubs." Tyler blinked. "You're kidding. We assumed it was instructional, was it not?" He laughed once, then winced as his ribs screamed. "No, it was not." The translucent one floated back to the others. The arguing resumed, louder now. Their words blurred together as they waved diagrams in the air. One projected a 3D model of a human torso, except it had 5 lungs and 2 livers stacked vertically. Another insisted on using regenerative gel designed for amphibious species. The third wanted to sedate him again and consult an ancient medical AI, apparently still rebooting from a system crash. Tyler's breathing hitched. The flutter in his chest grew sharper. His thigh pulsed with pressure, skin stretched tight against something underneath. He didn't need to be a trauma surgeon to know this wasn't headed anywhere good. He shouted, "I'm literally telling you what's wrong, and you're ignoring me." The orange one turned again. We do not agree on appropriate procedure. Your physiology contradicts known baselines. Then let me talk to a human doctor. There are no others on board. The colony shuttle suffered atmospheric rupture. That stopped Tyler cold. He stared at them. Everyone else? The translucent one tilted its head. No survivors. You are sole remaining human. The silence hung in the sterile air like a dropped scalpel. Tyler looked down at his hands. His fingernails were turning blue at the tips. Definitely a lung issue. And that leg, if he didn't relieve the pressure soon, he might lose it. He scanned the medbay. Clean, well lit, alien equipment everywhere, none of it labeled in English, except there, a red case mounted to the wall with a universal emergency symbol. Inside was a compact manual. Beside it, a set of surgical tools. No, he muttered, already knowing what he was about to do. He rolled off the table, his leg buckled, and he hit the floor hard, gasping. The aliens shrieked and hovered around him, but didn't touch him. Protocols, probably. Or fear. He was a complete biological mystery to them. Dragging himself on one elbow, he reached the wall case. His vision swam, and the edge of the cabinet sliced into his forearm as he forced it open. The manual flopped out. It was thick, with color-coded sections and microscopic text in 30 languages. He flipped to the red tab with a double helix symbol. A diagram showed a humanoid body. Close enough. He scanned instructions for relieving a hematoma and draining a pleural cavity. Some parts were familiar, most weren't. But he'd done field trauma repairs before, nothing this bad. But he didn't have a choice. It was this or wait for a committee to form. He grabbed the scalpel. The orange alien began vibrating. That is not approved protocol. Neither is waiting while I drown in my own chest fluid. He sterilized the blade with a nearby sprayer, then bit down on a towel. He carved into his side just below the ribcage, sharp and shallow. His scream turned into a wet groan. Fluid hissed out, air followed. He nearly passed out, but the pressure eased immediately. He could breathe. Next, the leg. He unwrapped the compression bandage and saw the angry bulge. He used the same scalpel, slicing through skin and fascia to relieve pressure. Blood spurted, then slowed. He tied a loose tourniquet below the cut. The aliens watched, silent, no longer arguing. 15 minutes later, he was lying on the floor, pale and shaking, surrounded by sterile towels and globs of alien antiseptic. The pain was nauseating, his vision was blurred, but he was breathing. His leg wasn't turning purple, and no one had sedated him mid-sentence. The eyeless alien approached and peered down at the manual which lay open beside him. This section, the translator said slowly, is labeled First Response Protocol, Sylvan Aquatids. Emergency procedure for gilled thoracic cavities. Tyler blinked at the page. The diagram showed a vaguely human shape, but it had fins and gills. I misread the tab. You operated on yourself, the orange one said, using a manual for a completely different species. Yeah, Tyler mumbled. And it worked. The three aliens stared at him. The translucent one finally said, Your resilience is statistically improbable. Tyler closed his eyes. Tell that to my thigh. Tyler didn't dream. He came back into consciousness the way a diver breaks water suddenly and with a gasp. The antiseptic tang hit him first, followed by the dull ache of every injury making itself known at once. His body felt like a stitched-together salvage job, which technically it was. He was back on the med table, limbs immobile under a lightweight restraining field. Not tight, more like a gentle force, discouraging movement, probably to keep him from grabbing another scalpel and playing surgeon again. Around him, the medbay hummed in low tones. The lights had dimmed to a softer hue. The three aliens hovered nearby, but there were others now. A fourth, with coral-like spines adjusting a console, and a fifth, short and covered in feathers, muttering translations into a palm-sized pad. A voice buzzed overhead. Subject is conscious. Containment protocols remain stable. neural responses within post-trauma range. Tyler's mouth was bone dry. Water. A brief pause. Then a metal straw descended from the ceiling with an oddly flexible pouch of liquid. He sipped. Electrolytes, and something faintly fruity alien, Gatorade maybe? The orange alien approached. "You are alert. This is encouraging. You sedated me after," Tyler croaked. "Ha! Didn't exactly ask. You lost significant blood volume. We calculated a 40% chance of cardiac arrest within the hour." Tyler didn't argue. He wasn't proud of what he'd done, and now that the adrenaline was gone, the pain was monumental. His leg had been elevated and fitted with a rigid, alien-style splint. A pressure monitor hovered beside it, displaying vitals he couldn't read. There was no cast, probably not their style, but judging by how heavy the limb felt, something had been fused or braced. "How bad was it?" he asked. The translucent alien responded this time, its translator softer. "Fascia split. Subcutaneous pooling extensive. You relieved pressure, preventing necrosis. Unorthodox but effective. Lung issue less so. Incision too shallow for full decompression." Was it enough? Barely. Tyler swallowed hard. "And the species I operated on, sylvanaquitids. What do they breathe exactly?" "Primarily brine vapor. Their gills secrete a vasoconstrictive compound. It is not advised for mammalian use." "Well," Tyler sighed, "guess I got lucky." "Statistically anomalous," the feathered alien added, tilting its head. "Possibly dangerous." Tyler frowned. "Dangerous?" "Unpredictable. Your actions introduced variables we could not model. Now the others wish to see you." "What others?" The wall parted behind the med table. Not a door, just a silent shift in structure. A long corridor extended into a deeper section of the ship. Through it came a procession of aliens, 6, maybe 7, all different sizes and shapes, wearing variations of what passed for lab coats or medical harnesses. One floated on a disc, another had wheels instead of feet. All had tablets or scanning devices, some visibly recording. Tyler groaned. "Am I a patient or a thesis?" "You are a dilemma," the orange one said. "We require consensus." Each of the newcomers took turns observing him. Some asked questions. Could he feel pressure here? Move this joint? Did he remember Earth's gravitational constant? One asked how he'd sterilize the scalpel. "They're turning this into a symposium," Tyler muttered, "over my open wounds." One particularly small alien with a porcelain exoskeleton asked, "What training do Terran civilians undergo for invasive procedures?" Tyler blinked. "None," the room murmured. "But you perform too," the porcelain one insisted. "Out of desperation," he said, "not preference." A few conferred in hushed tones, clearly troubled. The orange alien finally waved the rest out. The procession left as quickly as it had come, vanishing down the corridor. The room settled. Tyler's breathing slowed, though his side still hurt with every inhale. He shifted under the restraint field. "So what now?" The translucent one glided forward. "We debated surgical intervention. Some favored augmentation using exografts. Others wanted to remove your thigh muscle entirely and replace it with a biomechanical matrix. A minority proposed cryostasis and remote consultation with Earth." Tyler blinked. "What did you decide?" "We did not. While you were sedated, you stabilized further. Signs of clotting and tissue repair exceeded expectations." "So now what?" he asked again. The orange alien pointed to a screen. It showed a timer. "We observe. 24 Terran hours. Then we decide." Tyler exhaled. "Great." The next several hours passed in a fog of mild sedation and endless tests. They scanned his lungs, leg, even the insides of his fingernails. At one point they attached a node to his skull and tried to induce dreams for study, but his brain rejected the foreign stimulation. Another alien tried to harmonize his internal fluid pressure with sonic pulses, which just gave him a headache. When he was finally left alone, he stared at the ceiling, wondering how long it would be until he could walk. He knew enough about injuries like his to know that healing wouldn't be quick. Even with alien assistance, broken ribs could take 6 weeks. His leg, if there'd been muscle damage, could take 3 months. That was assuming they didn't decide to grow him a new one and swap it out. The translucent alien returned late in what he assumed was their night cycle. "You are awake still." No surprise. "You resisted sedation?" I replied it off. "I need to think." The alien paused. "About what?" "About how I'm going to convince you to let me heal the rest of the way on my own. You attempted self-surgery without appropriate knowledge. The result was success, but unrepeatable. Chaos is not a medical model." Tyler nodded. "True. But it worked because I knew what not to do. I didn't cut deep. I didn't aim for nerves. And I stopped when I felt things go wrong. That wasn't luck. That was controlled panic." The alien floated closer. "And you wish to continue improvising?" "No. I want guidance. But I don't want experimentation. You're studying me because you don't understand humans. I get it. But I'm not a lab rat. I'm the only one of me left." Silence stretched between them. Then the alien tilted its head. "We will consider your request." The lights dimmed further. A quiet whir indicated the field restraints lowering. Tyler sighed in relief, then winced, always the ribs. As the door resealed and the alien left, Tyler pulled the emergency manual back toward him. He flipped to a new section, Comparative Musculoskeletal Systems. This time, he double-checked the species tag. By the next waking cycle, Tyler was allowed to sit up on his own. Took nearly 15 minutes, multiple pauses, and the kind of focus usually reserved for diffusing explosives, but he managed it. The translucent alien, whose name Tyler still couldn't pronounce, hovered nearby, silently monitoring his vitals. His chest burned with every breath. His ribs wrapped in a semi-rigid support exoband, and his leg was stiff beneath a modified brace. Walking was out of the question, but he could think, and talk, and argue, which turned out to be crucial. "I told you I don't need a synthetic tendon grown from insect tissue," he snapped, gesturing at the projected diagram spinning midair in front of him. "Your guy over there wants to splice it into my thigh like it's a cracked coolant pipe." The coral-spined alien snorted through its translator. "Efficiency of chitin-based tensile structures far exceeds mammalian equivalents." Tyler shot a glance at the manual again, now dog-eared and riddled with sticky notes, most of which he'd scribbled in markers scavenged from a diagnostics terminal. He jabbed at one diagram. "And your last experiment with cross-species bioadhesive caused paralysis in the test subject. I read that footnote." The orange alien cut in. "That was a soft-shell Grax. You are not similar." "Exactly. I'm not. So stop treating me like some meat jigsaw puzzle." Silence followed. The other aliens in the medbay, there were 9 now, with rotations running day and night, gathered around. The feathered one, apparently a specialist in biological ethics, scratched something into a tablet. Finally, the eyeless alien moved. It tapped a command into the wall panel and a new image floated up. A human skeleton. His. "Then you lead," it said. Tyler blinked. "What?" "You claim autonomy. Then design your own recovery plan." He should have felt triumphant. Instead, he felt like someone had handed him the keys to a nuclear reactor and told him to fix the coolant system blindfolded. But he nodded anyway. "Fine. Then we start with diagnostics, actual ones, imaging, not guesswork. I want to know the extent of the damage, ligaments, muscle tear, rib count. No more speculation." They agreed, almost too quickly. Over the next 2 days, Tyler was wheeled through machines that pulsed, spun, and once made him taste electricity. High-resolution imaging gave him a terrifyingly clear look at his injuries: 4 fractured ribs, 2 of them cracked near the sternum. A small pocket of air still trapped in the pleural space, not enough to cause distress, but enough to need watching. His left thigh had narrowly avoided compartment syndrome, but there was residual tissue swelling and minor muscle tear. No broken bone, lucky. The data also confirmed something none of the aliens had seen before. Healing has accelerated, the coral-spined one admitted, even with minimal intervention. Not accelerated, Tyler corrected. Normal. You just didn't expect it. You self-regulated pressure, halted hemorrhaging, and avoided systemic infection. Statistically improbable. Not for someone trained in triage, he said. We get taught how to survive until help arrives. You've been acting like help never will. That quieted the room. After that, they relented. Tyler spent the next cycle devising a recovery regimen using alien equipment. He oversaw the fitting of a low-gravity brace to allow for eventual assisted walking. He requested tailored compression wraps that adjusted in real time to swelling. Most importantly, he insisted on daily breathing exercises to restore lung capacity. That meant pain and focus. You could request pharmacological suppression, the translucent alien offered as Tyler sat up and forced his ribs to expand. I don't want to delay healing, let it hurt. You are unique among mammals. Or we just don't heal in our sleep cycles the way you think. They monitored everything. At his request, the feathered alien helped convert pages of the manual into voice assist prompts. Tyler turned the medbay into a rehab station, makeshift and messy but functional. He learned to maneuver between benches using repulsion crutches. His thigh ached, and the brace bit into the skin when he overdid it, but he kept at it. Every step was brutal. One particularly bad stumble left him vomiting and breathless, ribs screaming in protest. Enough, the orange one said, gently restraining him. You worsen. No, I pushed the limit, Tyler gasped, wiping his mouth. That's how you find it. One night cycle later, he took 5 full steps, unaided. The medbay went silent. Not out of awe, just confusion. You're not ready, the porcelain exoskeleton alien said flatly. Tyler sat back down, hard. Didn't say I was, but now I know where my limit is today. The aliens gathered again, whispering in their coded frequencies. He caught snippets translated through the intercom. Inconsistency, one said. Heal rate variation, another muttered. Cannot model progress. The feathered one concluded, impossible to apply protocol. That was the moment Tyler realized they weren't trying to help him heal. They were trying to fit him. They didn't understand variance, they had no instinct for adaptation. And so they couldn't accept that a human body, damaged, in pain, and making it up as it went, could recover outside of their metrics. He stood again, this time with effort but without wobbling. His ribs still hurt, his legs still dragged slightly, but he looked around the medbay and said, You were trying to treat me like a system, but I'm not. I'm an organism. I heal because I adapt. You can't program that. The orange alien approached slowly. Yet you survived only by doing what no other species would. Tyler smirked. That's the point. They didn't answer right away, but they didn't restrain him again either. That night, as the lighting dimmed and the alien monitors flickered through their nightly diagnostic lull, Tyler sat alone with the manual again. He turned to the section on long-term recovery and stabilization. This time, he marked the correct species tab, but he still kept the aquatid page bookmarked, just in case. It took 3 more cycles before Tyler could walk without support. Not gracefully, not for long, and certainly not pain-free, but he could manage half the medbay's length with a determined shuffle and a white-knuckled grip on the rail. The aliens watched him, always quiet now, always observing. Their arguments had stopped. They'd begun to understand that humans didn't follow linear recovery curves. There were setbacks, spikes, plateaus. His lungs had required 2 more targeted interventions with their equipment, non-invasive this time, and the pleural space finally cleared with time and controlled breathing exercises. His ribs remained sore, especially in the cold, and the muscle in his thigh twitched unpredictably during rest. But he was healing, not because their protocols predicted it, because he'd forced the recovery into motion with pain, caution, and slow, stubborn persistence. The manual sat near his bedside, pages worn from overuse. Tyler no longer needed it. Not much, anyway. He knew what his body could do now. More importantly, so did they. The medbay doors opened without sound. The eyeless alien entered, followed by two others. One carried a small case. Tyler set down the cup of protein broth he'd been nursing. "You're not scanning me again. I draw the line at nasal probes." "No probes," said the translator. "We come to deliver status." Tyler raised an eyebrow. "Am I finally being released?" In a manner. The case was placed on the table beside him. It opened with a hiss. Inside was a data core, shaped like a flattened sphere, wrapped in a translucent insulating gel. "This," the eyeless one continued, "is a medical adaptation log, based on your case." Tyler frowned. "You made a file about me?" "We made a system. New baseline for Terran resilience. Fluid protocol design with variables, exception branches, and a Tyler window." "I have a window?" "A designation for recovery that defies optimal prediction but achieves viability." He stared at the glowing core. "So, a formal admission that you were wrong. An acknowledgement that healing cannot always be engineered." Tyler leaned back. "I'll take it." The second alien stepped forward. "In addition, a request." Tyler rubbed his temples. "This better not be about testing my spleen." "No, it is teaching. We do not wish to repeat the chaos of your care. We seek to prepare for more humans." Tyler sat with that a moment, then laughed, not mockingly, just in disbelief. "You want me to train you?" "Yes. Infield resilience, improvisation. Your trauma response is not reproducible, but elements can be studied." Tyler reached slowly for the broth again, sipped. "Let me get this straight. I wake up impaled, half drowned, and you spend a week debating whether to replace my thigh with a crustacean leg. Then I fix myself with a scalpel and a pamphlet written for a gill breather. And now you want me to teach med school?" "Yes." He looked at the ceiling for a long moment. "All right, but we're doing it my way." A brief silence followed. "Which is?" Tyler stood slow, cautious, favoring his good leg. "You let me set the first lesson, and the first lesson is this: your protocols are good, but sometimes the best tool is a little knowledge, a lot of stubbornness, and the ability to say no when everyone else says wait." The aliens made no reply, but the case was closed, reverently. The medbay light softened, dimmed into a gentle daylight hue. Later he was allowed access to the observation deck, his first time outside the medbay since waking. The view was staggering. Deep space, the pale blue curve of a gas giant framed in the window, tiny moons orbiting like scattered coins. He sat with a blanket across his legs, one arm still bandaged, watching as a comet streaked silently past. The orange alien joined him, carrying 2 cups. One was hot and smelled like citrus and something electrical. It passed it to him without comment. Tyler looked at the cup, then at the alien. "No poisons this time?" "Only if you define caffeine as poison." He smiled. The alien sat. Not close, but near enough. After a time, Tyler said, "You never really believed I'd make it." "No. And now, you are the variable." He nodded. "That'll do." Later still, he was shown a transport schedule. A relay vessel would pass nearby within weeks. A human-friendly outpost had been contacted. There was a place for him if he wanted it. He considered it, but for now he stayed. Not because he had to, because he had something to teach, something only chaos and survival could offer. And because, strange as it was, the medbay had become something else. A classroom, a lab, He never touched the scalpel again. But the knife, the manual, and the absurdly misfiled aquatid procedure, he kept those, just in case someone needed to learn the hard way. The only way that ever worked,